Also, and we have, as a group, I'd like to introduce Ahmet Çelen, Tyreen Evans, and Marcel Durran. And we have chosen question 16, which is the screening tools used to assess pregnant women. And within this research we have done, we have used many different theories that all suggest and state different dietary plans as well as exercises that are suitable for women. This will help athletes who are pregnant and still want to continue training, because many theorists have suggested that if a woman is to continue training, there is a much lower chance of obesity increase, and also it's healthy for the baby and the child. Within this, the age of the women are around 30, which is what we looked at, and this will basically be also include, like I said, the sporting sector will help athletes. Athletes be assessed. The kind of professional practice will require sports clinicians to understand and apply the professional codes that form decision making that include athletes' health. So, in other words, basically, the athlete's health and the baby is at most importance. These tools will, obviously different theories will show different tools used and different methods and different ways to grade. The presentation will look at the guidelines that a pregnant woman should follow, meaning there's different step-by-step rules and as well as different things.
Our client information is based on a 30-year-old woman who is 5.5 months pregnant, who is very interested in exercising, and at the stage of her pregnancy is currently suffering fatigue. She has had a medical screening and she has no medical issues so far. We looked at theorists that have done research on pregnant women who would like to exercise, and they found that Thompson found that obesity is basically a rise in pregnancy. When a woman is pregnant, obesity does occur. And that Mottola found that when you are pregnant, exercise does play a vital role in wanting to lose weight and not gaining that excess weight that she wouldn't like to gain.
Davis
states that a woman who is healthy and pregnant should partake in physical activity, and it would benefit both the mother and the child. In addition to this, Lady goes on to say that women have a tendency to gain weight when pregnant at a reproductive age, and it is important to exercise during pregnancy, basically to get rid of fluid retention and promote safe weight loss. Yeah.
Alright, they did a PowerMex Ed physical activity readiness evaluation form for pregnant people. Basically, it's a screening tool to make sure that they're physically fit enough to do exercise and to make sure that they won't come into no problems or contraindication. The guidelines use the FITT principle. It gives frequency, intensity, time, and type. So it basically sets out their thing. It basically sets out how hard they're gonna work, how many times they're gonna work, the type of exercise they're gonna work, and basically keeps it at a good tempo so that there's no problems with the baby. They have to complete this document and supply all important medical history, and basically they'll find anything that's bad in their history. They won't let them exercise, for instance. And they'll have evidence-based guidelines and aerobic and muscle conditioning activities. The PowerMex Egg was basically designed specifically for pregnant women, and is based on aerobic exercise, which consists of warm-ups and cool-downs being 5 to 10 minutes at a low intensity. So they won't work. So the pregnant women won't work too hard and cause strains on the baby, or won't do any rubbish exercises. The exercises that have been given are swimming and walking. So those are safe exercises for pregnant people. Family orientated intervention and dietary recommendations would help provide necessities to promote healthy lifestyles for pregnant women. That was said by Fronton et al. So basically it's talking about their dietary methods and the recommendations that they would give, and pregnant people could go there and find out what they can eat and what can help them, give them more energy and whatnot. Pregnant women consuming a vegetarian diet are predominantly suffering from vitamin deficiency. Yeah, if you're a vegetarian, you need to make sure you're having vitamin tablets. Yeah, and a Mediterranean diet helps. A Mediterranean diet is useful for pregnant women.
Okay. In continuation of research that's been into 30-year-old pregnant women, we've got a key study from Meltzer et al. He looked at cardiovascular adaptations to physical activity and pregnancy. So he found that there was changes in submaximal oxygen uptake, so the VO2 of the individual, depending on the type of exercise they performed. He performed weight-bearing exercises such as walking, stepping, or just regular treadmill exercises. So they found that the VO2 max significantly increased compared to non-pregnant women. So yeah, he proved that regular physical activity is beneficial for mother and the fetus during cardiovascular activities. So a recommendation that he gave is that regardless of the pregnancy, the individual should remain to 30 minutes of moderate activity daily. Another key study by Tendas et al. Examined the physical activity patterns among women from pre-pregnancy to the second trimester of pregnancy. So I think that's 19 to 24 weeks. He looked at 56 pregnant women. They was all involved in physical activity prior to conception. However, they did find a decrease in physical activity after the conception, and a further decrease in physical activity after the second trimester of pregnancy. There was, in the first trimester, he recommended that the 39.3% of a woman's week should consist of physical activity. However, that fell from 39.3% to 12.5% in the second trimester. So we can see, obviously, in the second trimester, there's a significant difference in percentage of physical activity compared to the first. So I recommend that they should have a training regime to increase the percentage to benefit the mother and the fetus. To summarize this presentation, I'm going to talk about some key points and suggestions for mothers that are going through pregnancy right now. So the subject that we had to do was suggest that optimum screening tools and recommendations for them dietary wise and physical activity wise. A good recommendation for them is to participate in 30 minutes of physical activity on a weekly basis, on a daily basis, preferably on a daily basis, including a training regime for the mother to partake in. The dietary plans, it's been found that a Mediterranean diet could benefit the pregnant woman. Sometimes consuming, like vegetarians should prevent, they do have a vitamin deficiency, so including more meat, protein into the diet will help a healthy lifestyle. It's been found that women between 9 to 24 weeks begin to overload on calcium products, beefy products, So we've suggested, there's been a suggestion by Thornton for a family-orientated intervention that include dietary recommendations for them. So yeah, if you are a woman suffering from such problems, you should have a look at further research on dietary plans and exercise procedures that follow. And yeah, so thank you, I hope you enjoyed it.